Social justice is, again, a basic tenet of social work practice. And every individual deserves equal rights and opportunities. And we're working with some of the most vulnerable and disenfranchised patients, so we are their voice as social workers. We can provide people a voice when they may not be able to speak for themselves.
Though soft-spoken when it comes to her own accomplishments, hospital social worker Karon Konner is a powerful voice for her clients and the hospital where she works.
Social work is really ingrained into Mass General. We were the first hospital social work department in the country, established in 1905. I first came to Mass General as a graduate student in my advanced year of my MSW program. It was my clinical internship, and I never left, which happens to some people here. You get here and you never leave.
And while she hasn't left, Karon has stayed very busy. She started out working in inpatient orthopedics and urology, among other capacities, before helping create her own position in 2006.
I co-founded with some interdisciplinary colleagues a specialized medical team, we call Team 5 for no particular reason, to care for patients at risk for long length of stay due to the complexity of their psychosocial issues. And this is a patient population where they may have many different agencies involved in some isolated aspect of their lives. So as the social worker, it's an opportunity to develop a comprehensive psychosocial assessment, putting all those pieces together to help guide the team in developing an optimal treatment plan for the patient.
Nurse practitioner Grace Good is Team 5's medical leader.
Karon has developed professional therapeutic relationships with our patients. Two examples that I could think of off the top of my head were two patients who came in as John Does. Karon was diligent, did her work thoroughly, found their identities, and was able to reconnect them with their families. As you can imagine, this was very emotional for everyone involved, and we were just thrilled with the work that she did.
Director of Social Services, Maria Elena Joyella, echoes that sentiment.
Karon is really a fierce advocate for patients in that she can hone in on exactly what it is they need and then represent that in whatever venues are required. So sometimes that's in the community, sometimes it's here at the hospital with other care providers, and sometimes it's with their families.
But Team 5 is just one aspect of Karon's work. In 2008, she was appointed as the guardianship consultant for the hospital, working with Mass General's lawyers and forensic psychiatrists to facilitate the process of finding surrogate decision makers for patients who are unable to make decisions for themselves. And as if that workload wasn't enough, Karon volunteered for one more responsibility.
I'm also a mental health specialist on Massachusetts One Disaster Medical Assistance Team, which is a part of the National Disaster Medical System, a division of the Department of Health and Human Services, and we deploy domestically and internationally in response to disasters.
Karon's DMAT team was deployed in response to Hurricane Katrina, Hurricane Ike in Galveston, Texas, the Red River floods in North Dakota, as well as to Haiti, just hours after the earthquake struck in 2010.
As the mental health specialist, our role is somewhat unique in that our first priority is really to our team and to each other, because you are a limited group of limited resources in the field, and you have to take care of one another in order to provide the best care to the patients that we serve.
Whether dealing with disaster medical assistance or Mass General's Team 5, Karon is constantly working to assure the best possible outcome for her patients and her colleagues. Karon plays a big role in many lives. As always, she deflects attention from herself. Karon Konner is all about team.
You can't do this work alone. It needs to be a team, and I feel very privileged to work with the interdisciplinary group that I do. And you need that support, and you need that collaboration in order to provide optimal care to our patients and their families.
But it is the people she helps at Mass General or during disaster relief, such as her work with tsunami survivors in Indonesia, that fuels Karon's resolve and passion for social work.
It's incredibly rewarding, and I feel like so often I get so much more from my clients or patients than I can give. It's inspiring when I see and hear what they're up against and what they get through. It's inspiring to me. You know, I think about the folks in Indonesia who truly had lost absolutely everything. Dozens of family members, their homes, their livelihood, their towns, and yet their resilience was incredible. And that gives me the energy and the inspiration that I need to continue to do this work.